Did you know that if a person takes one daily blood pressure medication, that they have a 40% chance of suffering from obstructive sleep apnea? If a person takes two daily blood pressure medications, they have a 60% chance of suffering from obstructive sleep apnea. And if a person has to take three blood pressure medications daily, they have obstructive sleep apnea until it's proven that they don't. Hi, I'm Dr. Paul Wylie, neuropsychiatry and sleep medicine specialist and the medical director of Preferred Research Partners. In this episode of Hope in the Pipeline, we will dive into the topic of obstructive sleep apnea and its impact on blood pressure, and how volunteering to participate in a local clinical research trial testing a new medication for treatment of sleep apnea with hypertension might be a benefit to you now and can be a big key to helping others have access to better treatments in the future. Obstructive apnea is a disorder occurring during sleep, characterized by repeated episodes of complete or partial collapse and blockage of the upper airway, causing the body to repeatedly get insufficient oxygen. Partial collapses of the airway are called hypopneas, and full collapses of the airway are called apneas. The collapses occur because of the normal loss of muscle tone in the neck and mouth we all experience during sleep. The only way to get the airway back open, and literally to stay alive, is to wake up from sleep and get back your muscle tone. The need to repeatedly, briefly wake up from sleep for a few seconds all night long results in a very poor quality of sleep and causes daytime sleepiness and fatigue. In addition, every time someone has to quickly come out of sleep in order to open up their airway and gasp for air, that sudden, abrupt arousal from sleep results in a burst of what we call sympathetic nervous system activity. The same nervous system that gets activated if, for example, someone suddenly jumps out from around a corner and frightens you and your heart rate spikes. And just like being suddenly frightened, suddenly coming to the surface of sleep to breathe again causes a sudden dramatic momentary increase in blood pressure. Levels of blood pressure bursts as high as 200/100 have been recorded at the end of apnea episodes, and these repeated bursts throughout the night also cause blood pressure to remain elevated throughout the entirety of the next day. So you can see how developing a single medication that treats both the obstructive sleep apnea and the high blood pressure could be very advantageous. Airway collapses during sleep occur more frequently in people who are obese, have neck sizes of 17 or higher in men, or 16 or higher in women, people who have large tonsils, large tongues, or elongated soft palates. In addition, people who have narrow or short lower jaws or craniofacial abnormalities are also at increased risk for suffering from sleep apnea. Obstructive sleep apnea can cause more than just hypertension. Stroke, heart attacks, congestive heart failure, atrial fibrillation, diabetes, seizures, and increased susceptibility to infections are all complications of obstructive sleep apnea that's left untreated. Sleep apnea also causes significant problems via daytime sleepiness and fatigue, including workplace errors and accidents due to impaired attention and concentration and impaired memory, absenteeism, presenteeism, weight gain, traffic accidents, and sleep apnea also contributes to an increased risk for developing cancer and reduces the ability to recover from cancer episodes. Finally, untreated obstructive sleep apnea causes an increased risk for mental health disorders such as depression. Obstructive sleep apnea also greatly increases the risk for developing dementia. Untreated obstructive sleep apnea greatly increases the risk for developing dementia. And finally, untreated obstructive sleep apnea can cause possible permanent damage to the brain's white matter. Overall, untreated obstructive sleep apnea increases the short and long-term risk of death by 17%, to include death on any night during sleep from not resuming breathing, particularly if someone's under the effect of any sedating or pain medications. I am pleased to report that at Preferred Research Partners, we are currently privileged to serve as a site for Mineralys Pharmaceutical Company to test a medication seeking to gain FDA approval for use in adults for the simultaneous treatment of someone who has both obstructive sleep apnea and hypertension. We are currently looking for individuals ages 18 years to 75 years who have both obstructive sleep apnea and high blood pressure or hypertension. We're asking them to help us further test the effectiveness and safety of this new medication in treating both conditions. This is a paid clinical trial, and participation in this research requires a previous sleep study that confirms a diagnosis of moderate to severe obstructive sleep apnea without significant central apnea, and ideally, a history of hypertension. If you or a loved one or a friend knows someone who has obstructive sleep apnea and hypertension, and think that they might be interested in exploring the possibility of joining this clinical trial, please check out our website or direct them to our website at preferredresearchpartners.com to learn more about this study. As always, please like, rate, and review our podcast, which helps more people find it and to learn from the educational content. If you know someone who you think might benefit from viewing this podcast episode, please share it with them. As always, thanks so much for listening to today's Hope in the Pipeline, and we'll see you again next time when we talk about idiopathic hypersomnia and narcolepsy.